Calling the 1 p.m. calendar for Health and Human Services. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business on Monday, February 10th, 2025, 1 p.m. in room 225. For those on Zoom, your audio will be muted and video disabled until shortly before it is your turn to testify. Each testifier will have 1 minute to testify. If there's a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. I will be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislature's website. You will find a link on the status page for the measure. So first up, SB 297, proposing constitutional amendment to the Constitution of the State of Hawaii to protect the right to reproductive freedom. First up, AAUW in support. Next, Hawaii Family Forum in opposition. Okay.
I know it's only 1 minute.
Yes.
Good morning.
Good
or
morning.
afternoon. I'm Eva Andrade, President and CEO of Hawai'i Family Forum. We're opposed to this bill basically because people don't understand what the term reproductive freedom is. Even supporters, we asked them and people were answering different things. So to put that out there to the wider community and have that enshrined in our Constitution is our concern. Thank you, Chair.
Okay, thank you very much. Next, we have Indivisible Hawaii in support, Democratic Party of Hawaii Education Caucus in support, American College of Obstetrics and Gynecology in support, Save Medicaid Hawaii in support, Indivisible Hawaii in support, Unite Here Local 5 in support, Americans Unite for Life in opposition, Americans Pacific Birth Collective in support. Charlene Crowley, are you present? Okay, moving on. Next we have, again, American College of Obstetrics and Gynecology in support, Hawaii Christian Coalition in opposition, Ayman El Swaifi in opposition. Are you present?
Not present on Zoom, Chair.
Okay, next we have Magoon Ohana providing comments, Eileen Garvers of DNP in support, Mike Galoyo Sr. in support. We have 41, 80, 60, 70 individuals in support and an equal number in opposition. Kim Cordery, are you present? In opposition. Okay. Victor Ramos in opposition. And again, approximately 65 people all in opposition. And those who have, we have James Wallace in opposition. Are you present? Okay. Anybody else wishing to testify on SB 297? Okay, seeing none, moving on. Next up, SB 1438, relating to home care agencies. First up, we have Department of Health in support. Okay.
Yeah.
Okay, please
Hi.
proceed. You have 1 minute.
Hi, Chair. Thank you. My name is Paula Serio. I'm the Chief for the Office of Healthcare Assurance for the Department of Health. We stand on our testimony in strong support of this bill.
Thank you very much. Jeremy Creekmore, Hawaii Association of Professional Nurses in support. Anybody else wishing to testify on SB 1438? Seeing none. Moving on, SB 1439, relating to nuisances. First up, we have Department of Health in support.
Good afternoon, Chair. Matthew Carano, Department of Health, Environmental Health Services Administrator. I just want to say we testify in support, and it's really straightforward that it gives us the opportunity and clarity to act when it's a threat to public or environmental health. Thank you.
Okay, thank you very much. Next, we have Magoon Ohana providing comments. Next, we have 25, 34 individuals, all in opposition. James Wallace, are you present? Okay, seeing none, moving on. Next up, we have SB 1441, relating to transition of Oahu Regional Healthcare System from Hawaii Health Systems Corporation into Department of Health. First up, Marian Suji and support. Not present. Sean Sanada of Oahu Region Hawaii Health Systems Corporation in support. Okay, anybody else wishing to testify on SB 1441? Seeing none, moving on. SB 1442, relating to mental health services for children and adolescents. First up, we have Behavioral Health, Department of Health in support.
Good afternoon, Chair. I'm Kaylee Aquaro. I'm the Administrator for the Child and Adolescent Mental Health Division. I stand on my written testimony and just want to point out that it's mostly housekeeping in nature. Our statute was over 50 years old, and so this will bring us up to date with how we currently function.
Okay, thank you very much.
Thank you so much.
Next, we have Hawaii Disability Rights Center providing comments. Louis Urchuk, are you present?
Not present on Zoom, Chair.
Okay, next we have Carla Hauser of RISE in support. Hawaii Youth Services Network in support. Consultant Trauma Informed Restorative Justice Consultant Godwin Higa in support. Christina Simmons in support. Veronica Moore in support. Anybody else wishing to testify on SB 1442? Seeing none. Okay, moving on. Anybody, SB 1443, relating to the Department of Health. First up, Department of Health in support. Anybody else wishing to testify on SB 1443? Seeing none, moving on. SB 1444, relating to general excise tax. First up, Hawaii State Department of Health in support.
Chair and members of this committee, my name is Chanel Gilligan, representing Adult Mental Health Commission. We stand on our written testimony and are in support.
Okay, thank you very much. Next, Department of Taxation providing comments. No tax. Tom Yamachika, Tax Foundation of Hawaii providing comments. Jade, please proceed.
Thank you. Aloha, Chair. This is Jade McMillan on behalf of the Tax Foundation of Hawaii. Our comments are directed towards the GET exemption, noting that we feel that increasing AMHD's appropriation so that it could procure services more competitively would be more appropriate. Thank you.
Okay, thank you very much. Next, we have Marilyn Akuram, Arch Service Provider, Aloha Care Homes Corporation in support. Eden Mabini in support. Anybody else wishing to testify on SB 1444? Seeing none, moving on. SB 1445, relating to youth mental health. First up, Department of Health, Behavioral Health Administration in support.
Good afternoon, Kaylee Aquaro, Child and Adolescent Mental Health Division Administrator. We support this, stand on our written testimony, and I'm available for questions.
Thank you very much. Opportunity for Youth Action Hawaii in support. Judith Clark, Hawaii Youth Services Network in support. Catholic Charities Hawaii in support. Hawaii State LGBTQ Commission. I see Mike Galoyo here present. Please proceed and support.
Good afternoon, Michael Goloyo Jr., he, him pronouns. I am the Vice Chair of the LGBTQ+ State Commission. We stand in strong support of this bill. We encourage you to, we do want to point out in our testimony that should this bill pass and become law, we would like to point out that we are asking for insurances that there will be help specifically for LGBTQIA+ youth as well as Native Hawaiian youth for their specific mental health needs. As you know, there is a dearth of missing mental health professionals to be able to address the needs of our mental health for our keiki. And we believe this is a step in the right direction to help fill that need.
Thank you very much. Next, we have Pride at Work in support. Nate Hicks, Hawaii Public Health Institute in support. Anybody else wishing to testify on SB 1445? Seeing none, moving on. SB 1449 relating to prior authorization of healthcare services. First up, we have Department of Health in support.
Stand our testimony in strong support. Thank you.
Thank you. Next, Hawaii Association of Health Plans providing comments. Rachel Wilkinson. Thank you very much. Jonathan Chin, Kaiser Permanente providing comments. Jonathan Ching, please
Aloha,
proceed.
Chair. Jonathan Ching for Kaiser Permanente. You have our written testimony. We are providing comments. We are seeking an amendment. We are in support of the reporting requirements, but we are asking it to be aligned to what we are submitting to the Center for Medicare and CMS itself. We'll be happy to answer any questions regarding our amendment.
Okay, I am going to note, maybe you may choose to provide late testimony, but your comments, Jonathan Ching, is for a different bill, HB 250. But moving on, next up, Hawaii Academy of Family Physicians Legislative Committee providing comments. Next, we have HMSA providing comments. I see Jen Deesman, please proceed.
Thank you, Chair. Senators, appreciate the opportunity. We're in support of the measure. We, along with Kaiser Permanente's comments, would like to align it to the CMS requirements that will be coming down, but we're also happy to continue the conversation. And we have our Chief Medical Officer here today if you have any questions about the processes. Thank you.
Okay, thank you very much. Next, we have Dr. Grosskreutz of Hawaii Provider Shortage Crisis Task Force in support. Dr. Ignacio, Hawaii Medical Association in support. Dr. Ignacio, you're present. Please proceed.
Aloha, good afternoon, Chair and Committee. Dr. Elizabeth Ignacio, President of Hawaii Medical Association. We stand on our written testimony and support with amendments. We are available for questions, Chair.
Okay, thank you very much. Next, we have Marty Taba, Dr. Taba in support, Dr. Gutling in support, Kathy Wilson, patient advocate in support, Dr. Garcia of Hawaii Medical Association in support. Dr. Garcia, are you present?
Not present on Zoom, Chair.
Okay, thank you. Next, we have Hawaii Society of Clinical Oncology in support. And anybody else wishing to testify on SB 1449? Members, any questions? Fire authorization bill. I have a question. Lauren Kim, come on up. Okay, so two things I want clarified. Normally, HMSA testified that health insurance plans are normally covered under insurance commissioner, but in this case, SHPTA wants to do the data gathering. Is that correct?
That's correct, because SHPTA has a lawful function to do healthcare planning and increase healthcare access. So we consider this access and availability issue, not insurance regulations.
Okay, another thing that HMSA pointed out is that there is the CFR, CMS, that's about to come out. When do you expect that to come out? Do you know?
I can't comment on that, but what we're proposing, or what SHPTA is proposing, on top of reporting, is to actually bring a HUI together so that we can establish community guidelines for the most common procedures that will obviate the need for prior authorization, or at least speed them up greatly. So it's not just the reporting, which we think is important just so people understand the shape of the universe, but it's the coming together to get agreement on what community clinical criteria can make prior auth go away or make it go much faster. That's really the heart of this bill, and that's something that we believe is squarely in SHPTA's wheelhouse.
Okay, so when I looked at the bill, and it's your bill, I mean Department of Health's bill, it doesn't really, it's just data gathering.
Oh, yeah, I'm sorry, my mistake. SHPTA may have provided, I guess you didn't call them, so they didn't provide amendments, but we were talking about amendments to a House bill that does include the community clinical standards, so I'm sorry, it is not referenced in the Senate bill. But we can get you that wording if you would be interested in considering it.
Okay, any other comments, questions, concerns? Seeing none, Vice Chair, moving on. Next up, SB 1450, relating to intensive mobile team pilot program for houseless individuals suffering from serious brain disorders. First up, we have Dr. Champion, Office of the Governor in support. Ryan Yamane, Director of Department of Human Services in support. Hawaii State Department of Health, Behavioral Health Administration in support.
Jack Koinagi, DOH Health Vision, strongly support this bill, standing on our written testimony, and we'll be here for questions.
Thank you, Dr. Koyanagi. Next, Reimagining Public Safety in Hawaii Coalition, providing comments. Liam Chin, are you present on Zoom?
Not present on Zoom, Chair.
Okay, next we have Raylan Reno Yeomans in opposition. Raylan Yeomans, are you present on Zoom?
Also not present on Zoom, Chair.
Eric Ave, Hawaii Primary Care Association in support. Hawaii Medical Association in support. HSAC, Hawaii Substance Abuse Coalition, Alan Johnson in support. Hawaii Health and Harm Reduction Center, Heather Lusk. Are you present, Heather? I see you. Please proceed.
Oh, thank you so much, Chair. Forgive me, I was a little bit late coming in. Is this related to SB 1450?
Yes.
Okay, thank you, Chair. So my apologies for wasting your time. Heather Lusk with the Hawaii Health and Harm Reduction Center, and we strongly support this measure. As someone who's had a street medicine program for over 8 years, the psychiatric population is one of the most challenging to be able to address, and we really feel like that this program would not only support that, it would get the much needed data. Street medicine has only been covered by Medicaid for a little over a year, and all of us doing this work are still trying to get the sustainability through Medicaid billing, and this pilot would help us work out things like insurance and others so that we can do this in a sustainable way on the streets where people, as you know, are struggling with mental health that leads to their homelessness and high touches with incarceration. Thank you so much for the opportunity to testify.
Okay, thank you. Kathy Helmus in support. Marsha He in support. Anybody else wishing to testify on SB 1450? Seeing none, members, any questions? Okay, moving on. Next up, SB 350, proposing an amendment to the Hawaii State Constitution to protect the right to contraception. First up, Sandy Ma, AAUW in support. Abby Simmons, Stonewall Caucus of Democratic Party of Hawaii in support. Abby, are you present?
Aloha, Chair. Mahalo for the opportunity to testify. My name is Abby Simmons. I'm Chair of the Stonewall Caucus of the Democratic Party of Hawaii. I stand in strong support of our written testimony. I think during times like these, it is more important than ever to make sure that we protect reproductive care and contraception. Thank you for the opportunity to testify. Mahalo.
Okay, thank you very much. Next up, we have Rainbow Family 808, Carolyn Galoyo. Are you present, Carolyn?
Not present on Zoom, Chair.
American College of Obstetrics and Gynecology Hawaii Section, support Indivisible Hawaii and support Democratic Party of Hawaii Education Caucus and support Unite Here Local 5 and support Indivisible Hawaii Healthcare Team and support Save Medicaid Hawaii and support Hawaii Christian Coalition in opposition. Margaret Mejia, are you present?
Not present on Zoom, Chair.
Eva Andrade, I see that you're present in opposition. Hawaii Family Forum. Okay, thank you very much. Next, Amen L. Swaifi in opposition. Amen, are you present?
Not present on Zoom, Chair.
Okay, next we have Yvette K. Indivisible Hawaii in support. Nancy Moser in support. Jennifer Bojanowski providing comments. And we have, goodness. Okay. 69. 72 persons in support and almost an equal number in opposition, but let's count it. 30. Oh, not so much. 48 members in opposition. Nicholas Leverance, Hawaii Health and Harm Reduction in support. Are you present? No. Okay, anybody else wishing to testify on SB 350? Seeing none, members, any questions? Seeing none, moving on. SB 1596 relating to nursing. First up, we have Department of Health providing comments. Okay, next, Laura Reichart, Hawaii State Center for Nursing providing comments. Maui College and support. Anybody else wishing to testify on SB 1596? Seeing none, moving on. SB 1565 relating to acupuncture. First up, Chelsea Fukunaga, Board of Acupuncture providing comments. Okay, thank you. Acupuncturists of Hawaii in support. Academy of Integrated Medicine Hawaii providing comments, Mike Hashimoto. Okay, Kailua Acupuncture Clinic in support, Heather McKay providing comments. 1, 2, 3, 4, 5, 6, 7, 8. 11 plus 8. 29 people in support. Acupuncturist of Hawaii, Cindy Chang, in support. Are you present? Okay, needles.
Cindy, stand by her testimony.
Okay, thank you. Okay, Institute of Clinical Acupuncture and Oriental Medicine, Lo, in support.
Yes, may I make a comment?
Yes, you have 1 minute.
1 minute. Succeed.
Well, we do have your written testimony
Yes,
too.
I stand by the written testimony, but I would like to amend the bill to include on line number 5 on page 1 to include the examination, evaluation, and diagnosis.
Examination, evaluation, and diagnosis.
Yes.
Okay, I suggest you provide late testimony on that for the next committee. Okay? Thank you very much. Any other persons wishing to testify on SB 1565? Members, any questions? Okay, seeing none, moving on. SB 1564, relating to Medicaid. First up, we have Ryan Yamane, Director of Department of Human Services, providing comments.
Madam Chair, we sent our written testimony offering comments available for any questions. Thank you.
Okay, thank you very much. ARP and support, Audrey?
ARP sent our testimony in support.
Okay, thank you. Adult foster care, Marfe Rotundo in support. 7 other individuals, all in support. Anybody else wishing to testify on SB 1564? Okay, members, any questions? Okay, seeing none. SB 1418, making an emergency appropriation to Department of Human Services. First up, Director Yamane in support.
Good afternoon, Chair, Vice Chair, and Committee. My name is Scott Morishige. I'm the Administrator of the Benefit, Employment, and Support Services Division of DHS on behalf of Director Yamane. We strongly support this administration measure. It will not only allow us to adjust our penalty with the Federal Food and Nutrition Service bill, also allow us to support the continued development of our system modernization efforts. Thank you for the opportunity to testify.
Okay, thank you very much. Luis Salavera, Department of Budget and Finance in support. Hawaii Primary Care Association in support. That's Eric Abe, Hawaii Appleseed. Okay, thank you very much. Daniela Spoto, Hawaii Appleseed in support. Nate Hicks, Hawaii Public Health Institute in support. I thought I saw him. Anybody else wishing to testify on SB 1418? Okay, seeing none. Members, any questions? Okay, seeing none, moving on. SB 1417, relating to crimes against protective services workers. Okay. First up, Director Yamane, come on up, in support.
Hey, aloha. Ryan Yamane here. In strong support, stand on our written testimony. We have our great staff here to answer any of your questions.
Yeah, I see half of them over here.
Oh, yeah. Good job,
Okay,
right?
thank you. Okay, Department of Law Enforcement in support, Kathy Seal. Hawaii Police Department in support, Thomas Chang. Captain Chang, are you present on Zoom? Please proceed.
He's present.
Yes, sorry. Good afternoon, Chair, Vice Chair, and members of the committee. I am Thomas Chang, Captain with the Honolulu Police Department. The department, we support Senate Bill number 1417. We stand by written testimony. I'm here to answer any of your questions. Thank you for your time.
Okay, thank you very much. Anybody else wishing to testify on SB 1417? Members, any questions? Okay, Captain Chang, I have a question, and I don't know if you can answer it.
Okay,
So
I'll try
in
my
the
best,
past-
Chair.
Yeah, in the past year, how many complaints do you know of crimes against Child Protective Services workers?
I don't have the stats on that. I can get back to you at the next hearing.
Okay, why do you I mean, is it significant enough that you feel we need to pass this bill, or are the laws that affect everybody?
Well, stat-wise, I'm not sure on that. I haven't heard it personally, but I think this bill is important because, especially if public servants, where Department of Human Service workers are sent to recover a child, to make sure that they're okay, and then they get assaulted or harmed. I think that's not right because we have other measures for public service workers. So I think they're similar. So we want to make sure that they're protected when they, go on behalf of the city and the state to do their job. We want to prevent this from happening. We want to hold people accountable, and I think this bill will strengthen our ways to protect the people of Hawaii.
Okay, thank you very much. Anybody else wishing to ask questions? Seeing none, moving on. SB 1411 relating to Medicaid third-party liability. Director Yamane just left. So anybody for Department of Human Services?
Hi, aloha, Judy Marquez, Medical Administrator. We stand on our written testimony and strong support.
Okay, anybody else wishing to testify on SB 1411? Seeing none, members, any questions? Okay, moving on. SB 1399 relating to Family Resilience Pilot Program. First up, Department of Human Services and Support, Director Yamane.
On behalf of Director Yamane, and Social Services Division Administrator, the department stands by its written testimony and support.
Okay, next up, I see Tia Hartsock. Come on up. Office of Wellness and Resilience and Support. Yes?
Stand on our testimony. Yeah.
Okay, you do? Thank you. Hawaii Youth Services Network and Support, Judith Clark. Are you present? Okay, seeing none. Laura Tachiki of Malama Ohana Working Group and Support. Okay, thank you, Laura. Okay, next we have Hawaii Health and Harm Reduction Center, Heather Lusk in support, Karen Worthington in support, Dana Matsunami in support. Anybody else wishing to testify on SB 1399? Seeing none, members, any questions? Okay, moving on. SB 1398 relating to trauma-informed care. First up, Director of Human Services and Support. Come on up, it's your turn. You time it just right, huh? Okay.
DHS stands in its testimony support.
Okay, thank you very much. I see Tia Hartsock, Office of Wellness and Resilience, in support.
Yes, we'll stand on our testimony and support and here for any questions.
Okay, thank you very much. You see Eric Abe, Hawaii Primary Care Association, in support. Okay, Hawaii Youth Services Network in support, Judith Clark, are you present? No. HSAC, Hawaii Substance Abuse Coalition in support, Alan Johnson. Malama Ohana Working Group, I see Laura Tochiki here in support. Okay, thank you. Epic Ohana Hopes Initiative, Charla Ann Holding in support. Hawaii Health and Harm Reduction Center, Heather Lusk in support. Veronica Moore in support. Karen Worthington in support. Anybody else wishing to testify in SB 1398 relating to trauma-informed care? Seeing none, members, any questions? Okay, seeing none, moving on. SB 1281 relating to telehealth. First up, Director Yamane, or
On behalf of Director Yamane at DHS, we stand on our written testimony and offer comments.
Which one? It was 1323, it said 1321.
oh, I'm sorry. This is SB 1281. Are we all on the same page? SB 1281, I know I'm moving fast.
Okay, yes, we are.
Okay, thank you. So you still stand in support on SB 1281?
We offered comments.
Yes. Oh, yeah, that's right, comments. Thank you. Insurance Division, DCCA, providing comments for anyone? Thank you very much. McKenna Woodward, Office of Hawaiian Affairs, in support. DCAB, Kirby Shaw, in support. DCAB, is Kirby Shaw present on Zoom?
Not present on Zoom, Chair.
Aloha Care, Mike Nguyen, in support. Okay, thank you very much. Hawaii Mental Health Coalition, Melissa Pavlicek, in support. Melissa, you present on Zoom? No,
Not present on Zoom, Chair.
Okay, thank you very much. Queens Health Systems, J.C. Mikulanek, in support. ARP, Audrey Suga Nakagawa, in support. Thank you. Hawaii Primary Care Association, Eric Abe, in support. Okay.
I'll be very brief. At the outset, I'd like to thank Senator Aquino for introducing this bill on behalf of the Hawaii Primary Care Association. This bill might be one of the most important measures this committee hears this year as it pertains to healthcare access to especially rural, isolated communities, to the kapuna, and to also the disabled. I'll be happy to answer any questions. Thank you.
Thank you very much. Next, we have Cynthia Au, American Cancer Society Cancer Action Network, in support. Okay, thank you very much. Hawaii Association of Health Plans, Rachel Wilkinson, providing comments.
Thank you, Chair. Within our written testimony, offering comments.
Okay, thank you. Samuel Shoemaker, Dean of the John Burns School of Medicine, UH Hawaii System, in support. Michael Robertson, Hawaii Pacific Health, in support. Hina Mauka, Brian Baker, in support. Hawaii Medical Association, Dr. Ignacio, in support. HSAC, Alan Johnson, support. Philippine Medical Association of Hawaii, Dr. Kiyohara, in support. Philippine Medical Association of Hawaii, Dr. Bautista, in support. Don Cariso of HMSA, in opposition. Okay, come on up, Walden.
Good afternoon, Chair San Buenaventura, Vice Chair Aquino, members of the committee. Walden on behalf of HMSA. I just want to start by saying that we strongly support the intent of extending Act 107 from 2023, but as the bill's written, we have grave concerns, and that's why we submitted testimony in opposition. Some could interpret that the definition of interactive telecommunication system, as read today, could be potentially expanding the applicability of audio-only telehealth. But when combined with federal regulation 1834M of the Social Security Act, it becomes clear that as of March 31st, 2025, when the PHE ends, audio-only telehealth in the home will only be allowed for services of diagnosis and evaluation for treatment of mental health, substance abuse, and monthly ESDR-related clinical assessments. Also, we feel that the 80% agreed upon reimbursement rate that 2023 passed was a reflection of clear collaboration between the stakeholders. And finally, in this bill, we don't agree with removing the ability to initiate audio-only telehealth or maintain it with just, without the use of telehealth. And so for those reasons, we provided recommendations, and we hope that the committee will consider it. Thank you.
Okay, thank you very much. Princess Kakpal, in support. Alzheimer's Association of Hawaii, in support. Anybody else wishing to testify on SB 1281? Okay, for SB 279. Oh, members, any questions? Audio only telehealth. Okay.
I apologize, I couldn't hear out there, and the mental health coalition stands in support of this vision. Thank you. I know you called me.
Yes. Okay, thank you, Melissa. Anybody else wishing to testify on SB 1281? Seeing none, members, any questions? Okay, moving on. SB 1279, telepharmacy. First up, we have Rochelle Araki, Board of Pharmacy, providing comments. Thank you. Next, we have Romy Glidewell, Department of Corrections and Rehabilitations and Support, DCR. Thank you very much. Cynthia Au, American Cancer Society Cancer Action Network, in support. AARP, Audrey Suga Nakagawa, in support. Okay. Dr. Taniguchi, in support. Melissa Baumgarten, in support. Grassroots Institute of Hawaii, in support. Alzheimer's Association of Hawaii, in support. American Diabetes Association, in support. Anybody else wishing to testify on SB 1279?
As of last night, it appears as though our testimony was not posted. Here are copies of our testimony. In essence, I'd like to thank Senator Aquino again for introducing this measure on behalf of the Hawaii Primary Care Association. This is an issue that the Hawaii Primary Care Association has worked on for a number of years. Like the previous bill, this is also another measure that will have direct impacts, especially to neighbor island and rural and isolated communities. This bill strengthens the state's commitment to the 340B program, as well as ensuring that all communities will have access to prescription drugs at reduced costs in an expedited manner. Thank you very much.
Okay. Anybody else wishing to testify on SB 1279? Okay, seeing none, members, any questions? Seeing none, we have quorum. Are we ready for decision making?
Chair, I'm so sorry. I don't believe SB 1320 was called.
Okay, let's make sure. Thank you. And where the heck are we? Oh, yes, that's a big one. Sorry. That was what my office was informing me. So SB 1323. First up, we have, hold on. Yeah, Dr. Michael Champion in support. Okay, Office of the Governor. Department of Attorney General in support, Ernie Lau. Aaron Lau,
Good
that's
afternoon,
you.
Chair.
Thank you. In support.
Good afternoon, Chair and members of the committee. Deputy Attorney General Aaron Lau for the Department of the Attorney General. We are in strong support of this bill. It will update our current laws regarding advanced healthcare directives and recognizing that the different nuances regarding capacity and make it easier for our community to create advanced healthcare directives, which is so important. Every day we hear stories about people who are having trouble understanding what their loved ones wanted. And if we can make it easier for them to help people plan ahead, then I believe that we should be supporting this bill, and I'm available for any questions.
Okay, thank you very much. Next, we have Edward Chu, Hawaii Health Systems Corporation, providing comments.
We'll stand on our written testimony.
Okay, thank you. Peter Hamasaki, Commission to Promote Uniform Legislation and Support. Peter, are you present on Zoom?
Yes, thank you. We'll stand on our testimony in support of this measure, which enacts the uniform law. Thank you.
Okay, thank you very much. Louis Urchuk, Hawaii Disability Rights Center in opposition. Louis, are you present on Zoom?
Yes, I am, Senator. Thank you. I appreciate I appreciate the chance to testify. I don't really care about the housekeeping stuff that's in the bill. That's fine. My issue is that so-called Ulysses clause. So basically what that does is get somebody to sign something saying, if I ever get incapacitated and they want to involuntarily medicate me, it's fine, I consent. So basically, this is just sort of an underhanded way to get somebody to waive their constitutional rights. I cannot believe it's legal or constitutional. If they want to involuntarily medicate somebody, they have to go through a court procedure. They can't just say, hey, you signed a piece of paper saying it's okay, so now we're going to do it. I can't believe that they would attempt to do anything like that. I can't believe a doctor would want to do it. So that's my issue, Senator. The rest of the bill, I don't really have any issue with, but I hope that you'll take a serious look, because I cannot believe that thing is legal the way it's written. So thank you.
Okay, thank you very much. Next, we have Raylan Yeomans in opposition. Is that you, Raylan? Please proceed, Raylan.
Yes, hi. Thank you for the opportunity to testify. I also have concerns about the Ulysses clause. That is brand new, was inserted in 2023. It's not widely used. And to basically, this bill is asking the Attorney General to draft model forms and make them available on a website for anyone to download. And to have something like the Ulysses grant, this Ulysses option in a downloadable form where two people, all you need is two signatures, doesn't even have to be a doctor, no explanation of what it means, is really, yeah, it could be, have a lot of unintended consequences. There's not, I don't know how many states are even using them, but also I think Hawaii, by making it literally downloadable so that people could be signing it and don't even know what it is drafting one and making it available.
Thank you, Ms.
Seems
Yeoman.
overreaching.
Thank you. Okay, anybody else wishing to testify on SB 1323? Members, any questions? So I have a question, Lois Erchik. So you're an attorney like I'm an attorney, okay?
Right.
Even before this was drafted, we've had the Advanced Healthcare Directive law, right?
Yes.
Which has been around since the 90s. That's it's almost 30 plus years ago. That one required the Attorney General to have uniform forms, and it already also have what you call the Ulysses Clause, because it allowed a person to appoint a surrogate. Because I mean, already, so what's the difference between our existing law, which allows for that, and what you are complaining about now?
Well, according to the bill, this is a new provision, so that's what I'm reacting to. I've never seen that used in the existing law. I suppose, Senator, if the argument is that, well, they can authorize it if they feel like it. But what I'm suggesting is that when push comes to shove, if the person changes their mind, I don't see how this thing is worth the paper it's printed on. I cannot imagine that anybody could say, well, we no longer have to go and get a court order because the person at one time signed a document saying that it's okay to be involuntarily medicated. They would still have to otherwise meet the criteria. They would still have to go through some sort of a formal process.
Okay, thank you very much. Deputy AG, you heard my question. We already have an existing law that has this Advanced Healthcare Directive that's been around for 30 years, which assigns somebody. So what's the difference between that law and why do we need this when we already have that
The
option?
difference between our current laws and this law is that it requires 2 signatures. You could create a Ulysses clause under our current law already without any signatures. So this actually safeguards that very important decision to decide on what medications you want when you are having a mental episode and orally refusing treatment during that mental episode.
Okay, I'm going to disagree with you there. It requires 2 signatures now or a notary public. Does this allow for that option?
I'm sorry, Chair, respectfully.
I can pull it up.
Right.
Okay,
Please,
it's your form.
It should be that the power of attorney
Power of attorney does not require, but Advanced Healthcare Directive does require 2 signatures or a notary public.
If you're going to appoint power of attorney, yes, it does.
Advanced healthcare, medical decisions, right?
Right, so there is that directive, and then you can appoint someone in that directive. And if you appoint someone as your power of attorney, then you would require 2 signatures.
Yeah, for medical decisions.
For medical decisions.
Right, thank you. Any questions? Okay, seeing none, are we ready for decision making now? Okay, so we're rolling directly into decision making. SB 297, Chair's recommendation is to pass. Is Vice Chair ready for the votes? Yeah. SB 297, Chair's recommendation to pass as is. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, voting on Senate Bill 297, recommendation is to pass as is. Chair votes aye, Vice Chair votes aye. Senator Hashimoto. Aye. Senator Keokolole. Aye. Senator Favela is excused. Recommendation is adopted, Chair.
Okay, for SB 1439. 38. Oh, excuse me, 38? Yep, SB 14, I'm gonna just follow the calendar. For SB 1438, relating to home care agencies, Chair's recommendation is to pass that as is. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, voting on Senate Bill 1438, recommendation of the Chair to pass as is. Noting the excused absence of Senator Favela, any reservations, any noes? Recommendation is adopted, Chair.
Okay, for SB 1439, Chair's recommendation is to pass with amendments We're gonna note that the word foul, F-O-U-L, is easily misinterpreted as shown by a lot of opposition to this where they assumed it was F-O-W-L. And so we're gonna remove that word because it's also redundant anyway. So with those amendments, any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, voting on Senate Bill 1439, recommendation is to pass as a SD1, noting the excused absence of Senator Favela. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for SB 1441, I'm not gonna do what Department of Health wants. We are going to pass this with amendments. We're gonna retain all proposed deletion except remove every reference of the year 2025 to 2029. And technical and non-substantive amendments needed for clarity and consistency. We're gonna work on this until we get it right, but we're not gonna give you a blank check. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Pass with amendments.
Thank you very much, Chair. Senate Bill 1441, recommendation is to pass with amendments. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for SB 1442, Chair's recommendation is to pass with only tech amendments. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay. Voting on Senate Bill 1442, it's a Senate Draft 1. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for SB 1443, we had no testimony on this. So,
I'm sorry, Chair, I think that there may be late testimony.
no late testimony. I called. Nobody testified.
We have testimony that we can submit to you right now.
Okay, so we're in decision making. We're gonna, no, we're done. We're decision making time, sorry. We called, no one testified, no one submitted. But in consideration, we're just gonna put in a defect date. You put in the, but again, if by conference there's no testimony, it's dead, right? SB 1443. Any comments, questions, concerns? Pass with tech amendments and a defect date.
Okay, thank you very much, Chair. Senate Bill 1443, recommendation is to pass with, as a Senate Draft 1. Okay, 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, SB 1444. Chair's recommendation is to pass this with tech amendments. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, voting on Senate Bill 1444, recommendation is to pass as Senate Draft 1. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SB 1445, Chair's recommendation is to pass with tech amendments. We're gonna blank out the appropriations. We're gonna put in the committee report the $500,000 request for 2025 to 2026 and $250,000 for the fiscal year 2026, 2027. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, Senate Bill 1445, recommendation is to pass with amendments. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, so 1449. Seems like it's just data gathering right now. We're gonna pass this with tech amendments. We're gonna put in a defect date to allow, again, the Health Department to get their act together and get a testimony as to what kind of amendments they want. Otherwise, pass with tech amendments and a defect date. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, Senate Bill 1449, recommendation is to pass as Senate Draft 1. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, so for SB 1450, okay, Chair's recommendation is to pass with tech amendments, blank out the appropriation, add a defect date of December 31, 2050. In the committee report, we're gonna put in the $1.3 million request for the appropriation amount. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, Senate Bill 1450, recommendation is to pass as Senate Draft 1. Okay, 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SB 350, Chair's recommendation is to pass this with tech amendments. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, voting on Senate Bill 350, recommendation is to pass with amendments. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SB 1596, Chair's recommendation is to pass blank out with blank out the appropriation request, replace the Department of Health with State Board of Nursing, put in a defective date of December 31, 2050. And other than that, any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, Senate Bill 1596, recommendation is to pass with amendments. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, so for SB 1565, I know that there was a request for amendments. We don't have any of the written amendments. We're gonna pass this as is. It's basically just a recognition of what acupuncture is, so. Any comments, questions, or concerns? Pass it as is.
Okay, Senate Bill 1565, recommendation is to pass unamended. Okay, 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
For SB 1564, Chair's recommendation is to pass this with blanking out the appropriations. We're gonna insert $35 million in the blank, in the committee report, where of the $35 million, 14.3 million are state funds and 20.7 in federal funds. We're gonna add in a defect date of December 31, 2050. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, voting on Senate Bill 1564, recommendation is to pass with amendments. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, 1418, emergency appropriation. Chair's recommendation is to pass this with amendments. We're gonna accept Budget and Finance's proposed amendments. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, voting on Senate Bill 1418, recommendation is to pass with amendments. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
As for SB 1417, Chair's recommendation is to pass this as is. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, voting on Senate Bill 1417, recommendation is to pass unamended. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for SB 1411, Chair's recommendation is to pass this with just tech amendments. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, voting on Senate Bill 1411, recommendation is to pass with amendments. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
SB 1399, Chair's recommendation is to pass this with blank appropriations, technical amendments as necessary, and a defective date of December 31, 2050. In the committee report, we're gonna note the request of $987,150 for this pilot program. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, voting on Senate Bill 1399, recommendation is to pass with amendments. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for SB 1398, Chair's recommendation is to pass this with amendments. We're gonna blank out the appropriations, and we're gonna note in the on the committee report, the request of $425,000. We're also gonna add a defective date of December 31, 2050 to continue on a conversation. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, voting on Senate Bill 1398, recommendation is to pass as Senate Draft 1. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for 1323, Chair's recommendation is to pass this with amendments. My DM notes are not current, excuse me. Yes, thank you. Okay, what we're gonna do is on page 36, line 13, we're gonna remove the phrase agent of and add in, hold on, that doesn't make sense. Yeah. No, I got it. We're gonna, just remove agent of on page 13. We're gonna accept HHSC's proposed amendments of number 4 and number 7. And we're gonna add a defective date to continue the conversation. Any comments, questions, or concerns? Okay, to clarify, the agent of is coming out of line 13, page 36. So that phrase will be the default surrogate status as an authorized representative without the phrase agent of. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Yes, Senate Bill 1323, recommendation is to pass with amendments. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, so for SB 1281, Chair's recommendation is to pass with amendments. We're gonna remove the phrase "or does not consent to" everywhere it's seen. So that would be on page 3, line 8, page 8, line 7, page 12, line 4, page 16, line 4, page 19, line 10. And we're gonna add in a defective date of December 31, 2050 to continue on with the conversation. So basically, we're going to try to continue on with the existing audio-only telehealth. And I'm going to note that the House version is passing, which significantly limits the audio-only telehealth to behavioral health services only, which is what the Medicare regulations are also appears to be headed towards. So conversation needs to continue. But we see the need for audio-only telehealth in limited circumstances. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote, pass with amendments.
Yes, Senate Bill 1281, recommendation is to pass as Senate Draft 1. Okay, 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Thank you. For SB 1279, Chair's recommendation is to pass with tech amendments. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Yes, Senate Bill 1279, recommendation is to pass with amendments. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
We are adjourned. Thank you very much.